Hello, everyone over there and here. We are excited this morning. I'm going to say welcome to the Empowering New Nurses show. This morning, I have a guest, and guess what? We're sitting in the lab. We are in the lab. I have a lab director here with me, a simulation director. And you might be wondering over there, what does that mean? So today, I just want to welcome Professor Karen Koziol. Karen, can you tell us about yourself? Just a little.
A little. I am director of clinical simulation at one of the local colleges. And the beautiful lab we're sitting in, I helped build. And I've actually built two other labs for this same college. And I've consulted with some of the community colleges in the Hudson Valley.
Great.
And also another college. And in January, I got to build a simulation lab in India.
Wow.
So, and that was amazing because it was very forward thinking. It's a facility for geriatric care. And that simulation lab was directed for nurses to try to help them practice some skills that may be rusty when you're in the geriatric facility. So it was a great experience.
And you know what? I was excited because I was privileged to get to hear the report from you directly and others from the Sigma Theta Tau International.
Yes. Sigma Theta Tau helped sponsor the event, and my colleague Dr. Varghese and I are in the process of writing it up, so you'll read all about it soon.
Great.
But it was definitely advances in clinical care for the geriatric population. And what was surprising to me is, personally, I have a background in pediatrics, so taking care of the elderly population was new and exciting for me.
So you see, we all have specialties and we all contribute in different ways. So thank you so much for going to India and helping those nurses along the way of improving and advancing in their skills. That's great. That's great. So right now I'm excited because you know what? I attended the school. So I'm seeing behind me this great advancement in the lab, different areas here. It's like I'm in the hospital setting, and that's important.
Yes. This lab here is an interprofessional lab, but I helped to build it and chose furniture, equipment, head walls that you find in a hospital situation, so that not just nursing students, but OT, PT can get used to taking care of patients in an inpatient setting. I have diverse mannequins, although sometimes the mannequins are a little
Stiff?
A little stiff. Yeah, it's hard to accept that they're real. You have to suspend disbelief about that. But once you do and get into the fact that it's a patient you're taking care of, real learning can occur. So I have mannequins like the one behind us that has no electric parts. And then I have mid-fidelity mannequins in front of us, and even high-fidelity mannequins that cost into the $100,000s of dollars that do breath sounds, heart sounds, bowel sounds.
They talk back to you
they
too.
They do. They have features that have speech.
Yeah.
And I have one mannequin that can cry and sweat and has oral and nasal secretions.
Wow, that must be costly then.
Yes. And it's very effective. We use him, the speech and language students at this college, soon to be university, practice him for intubation. The nursing students do mock codes.
Wow.
And other students
and you get a feedback there.
Other scenarios, correct. And in the lab, I don't know, you can't really see in this picture, but I have camera system built in to be an eye in the sky. So like an athlete, when we're done with the practicing, we can debrief and go to the videotape and show the students exactly physically what was going on. And debriefing really is where the learning happens in simulation.
What could have been done differently? What would have helped? And so forth. So once you're able to recall and you can assess, you can analyze, and of course give the rationale for what. That's exciting. That's exciting.
And really with simulation, that's the key, is reflection. So what happens in this sim lab stays in the sim lab. We're a little like Las Vegas there. But the real learning happens when people think back about what went well, what maybe could do different, and more importantly, what are you going to take away with you from what just happened?
Mhm.
So if we're doing a IV insertion, did you need 3 sticks and why? How were you holding it?
Mhm.
Did the angle of approach to the vein change? If you're doing a catheter situation, if you're doing a mock code, did you recognize the
This rhythms.
exactly,
Mhm.
exactly.
The
So
changes, and yes, so it's so important, and I'm so happy we have advanced, because let me tell you this: when in my time at my school, and that was in the West Indies, we had some some classes they did it on oranges, like for practice injection, for skills, only skills.
here in New York, we do. I did the same thing. My fundamentals class was in 1973, so it was 50 years ago, and we used oranges too.
But my classmate, I remember he was from Bermuda, and he actually gave me iron. We had to make it as practical as possible, and we all learned from it because they wanted us to feel what the patient feels.
Yes,
That
yeah.
was a part of our training. So, but I am so excited, and thanks for sharing all of that. But do you have many young nurses, or from your experience recently, you have a lot of new nurses coming in, or you have like second career nurses coming in? What is it like for you?
Well, in the program here, we have a mix of right straight from high school students, and then a fair amount of second career students who, for whatever reason, decided they wanted to change their
Career.
situation and thought they'd give nursing school a try. We've had people who are maybe physicians in other countries who come here and with the goal of becoming a nurse practitioner instead of doing the physician thing. We've had students right from high school. We have students who are high school athletes who are here to play on our teams and get an education in nursing while they're at it. So it runs the gamut.
That's great. That's great. Has always been a pleasure meeting you, because you know what? You have that compassion. You have that teaching style that it's something to embrace, others to embrace, because this professor, this lab director, simulation lab, she has so much to offer, and she does it with such compassion, with such tenderness. And from I met her, she has been one of my, what should I say? My arms, what should I say?
Mentors, but mentors go both ways, because I mentored you with some things, but you mentored me with others. So, and that's how it is in nursing. For example, I worked as a staff nurse basically from 1974 to 2010, before I went into academia. And then I continue to do staff nursing, but not
much,
not full time anymore. And one day I would be in charge and everybody would come to me with the questions. And then the next day somebody else would be in charge and I would come to them with the same questions they would have asked me yesterday. So that's how it is in nursing. Like one day you have to pick up the mantle, and another day somebody else will carry the burden.
Oh no. Sorry about that. Let me tell you something. I am so excited when I see our new nurses coming on board, because I had the opportunity many, many times to help them with their skills. For example, you'll have the new nurses, they have come and they're scared. They're really scared, because remember, at this point, it is not the academia. Yes, you're going to collaborate and all of that, right? And integrate. However, the hands-on in the hospital setting, so important. And some of them are so scared on onboarding. Yes, they've got the NCLEX, they've got the exams, but to come in the hospital and work on the real patient, not in the lab now, the real patient. And I've found that some of them have found that very challenging. And because they're so scared, they want to do it right, but there's so many questions that have. And at first, to be honest, it seemed overwhelming, because a lot of information.
It does. And, I've been so lucky, so fortunate with a few of them who graduate, pass the NCLEX, get their first job. But sometimes what they've done is they've actually called me up and, Professor, can I come in on a Saturday or a weekend and practice my skills in the lab because I'm going to orientation? I go, sure. I think just because you graduate doesn't mean that we can't continue to help
Thank
people.
you.
And when I was a new nurse, I remember the old seasoned nurses saying to me, "Oh, you college girls don't know anything." And I said to them, "You're so right, but thank God you're here to teach me." Maybe I won them over that way.
You had the right approach there.
They taught me everything they know, and they were fabulous hands-on nurses. So I can't say that I was ever bullied or eaten as a young nurse, but I know that that happens.
Yes.
And it's not really to our profession's advantage that we do that. As a matter of fact, the opposite is true, to treat the new nurses with kindness, and also eventually the old nurses with kindness too.
Of course, because right now I know you're great in IT.
Yes,
you are.
Yes.
That's one of your strengths.
I'm not afraid of it, but
you have
I'm
so
not
much to
as
offer.
Good at it as the 20-year-olds who grew up with
Karen.
I'm good with it.
You're good with it in comparison to other baby boomers in nursing. You are, right? And I want you to take that credit. But at the same time, I'm just saying, look, it's so important to balance it because we learn from each other. The senior nurses might not be, and many times are not as good as the young nurse, the one who born, the native language is technology.
Yes, yeah, we call ourselves digital immigrants, don't we? And my daddy, who's 96, says, I'm still in the digital old country.
Right. So it's so important for us to balance. You work from me. I learn from you. You learn from me. And this is how it should be. We should embrace each other's strength, right?
Yes.
And make it happen for the good of the patient, So I have, because of my years of experience and the knowledge I gained over the years, I've decided that I've done a podcast course and I'm still in it, but I've learned so much. And my mentors, they actually encourage me to put some of if you go online, take some of the information I have there and put it into a book in addition to other things. And I said, wow. And when some students or young nurses have seen it, they're so excited. They say, yes, we need this. So that book's supposed to be coming out in June.
I am so excited about the book because from the years you have mentoring, bringing in new nurses,
yes.
You have seen a pattern of things that really are commonalities in all new nurses.
The fears, the different type of fears.
And fears or concerns or ways to navigate this new life. Yes. And, I guess being a nurse, we're like being, once a nurse, always a nurse, like the Marine Corps. But bringing new nurses into any kind of a community, different hospital facilities, different academic facilities, a place where people work together. And everybody has their strengths.
And when you can identify and help them to grow. And bear in mind also that not everyone who gets an A in academia, when it comes to the bedside, their strength is different. And I've seen that repeatedly. However, once they have gained that experience and able to relate to and have the rationale and the critical thinking, but you have to get some information on which to build.
Sometimes people don't get A's because of
different reasons.
Their lifestyle. For example, when I was a student, my mother told me I couldn't go to a diploma school. I had to go to a hospital. I had to go to college. She didn't give me any money to do it. So unfortunately, when I was a student, I was working full-time and going to school full-time, and I was happy with the B, but I knew I was smart.
Yes, of course you are. You are.
And it turned out that I ended up making a career in nursing, and I'm pretty good at it.
You are.
I was smart enough to know, okay, I worked 8 hours at work last night. I got 8 hours today of school. How am I going to make it work? I come to the conclusion sometimes and forgive me as an instructor for saying it, but sometimes with schoolwork, it doesn't have to be good. It just has to be done.
Well, when in the podcast, my instructor said, get that book out. Get
Yes,
that book
yeah,
out. It
get
doesn't have to
out.
be perfect.
Perfect. Yeah, perfection is the enemy of progress, I think.
Say,
Yeah.
you better get it done.
Now, you can't be taking
You're not taking it
corners
for
as a
granted,
nurse.
though, you know.
Yeah, you're doing the right things for your patient all the time, but that's what report's for. So if you have 20 things to do for the patient and you only got to 19 and a half, you tell the next shift that I did everything except this. Can you do, can you
Yeah.
hang that item?
It's continuous. Nursing is continuous, and that's important to
Exactly.
know. And we should treat each other. You do unto others as you'd like them to do unto you. If that was not completed for whatever reason, maybe as you're about to, there's a patient who coded, you have to, put that on a pause to make sure that this is addressed immediately.
Exactly. And sometimes the two situations are equally urgent, and then you have to, in your mind, triage, which
Yeah.
is the most urgent of the two urgent.
It's interesting. But listen, I'm so grateful to you for having come in on this show to share with our young nurses and our senior nurses what it's all about in nursing. There's so much to it. But another time we'll continue. But thank you so much for coming on, Professor Koziol.
Oh, you're welcome. I love having you here. And sometime I'd love to give you all a tour of the lab.
I will appreciate
Okay.
that. So thanks. And my young nurses and senior nurses too, how can you contact me? You can contact me on YouTube, Miriam Amanda Smith. On Instagram, Podcast Mir. I'm also on Apple. I'm on TikTok. I am also on Facebook. I look forward to you getting my book, which is Nurses, the Guide to Empower New Nurses, Deliver High Quality Nursing Care to All Patients. That's great. You need to. And your pearl, you'll take your pearl and you'll embrace it and you'll take it as you go along in this noble profession. Thanks for watching, and we look forward to hearing you. Now, you're going to subscribe. You're also going to tell someone.
If you like this, put a thumbs up.
Yes, and a helpful
comment.
And a helpful comment. Yes. Thank you. Have a great day. Thanks for sharing, Karen.
You're welcome.
Okay.
This is the first time I've done a podcast, Miriam.